Before we get started, I would like to read the disclaimer on your screen. The Pharmacist Virtual Learning Experience, brought to you by Mandell's Clinical Pharmacy, is intended not only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandell's Clinical Pharmacy according to the prescription as written by the provider. Thank you everyone for tuning in to Pharmacist Virtual Learning Experience, an educational program created by Mandell's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home. My name is Tony Newman. I'll be your host tonight. I've been a nurse for over 10 years, with the last 3 years being in the fertility world. I'm from the New Orleans area, and I'm very excited to be part of this education program with Mandell's. The Pharmacist takes place every Monday at 7 p.m. Eastern. Tonight, we will be providing a live medication instructional program on 3 common fertility products: Menopur 75-unit vial, the Gonal F pen, and HCG. This will also include a live Q&A interactive throughout the program. Please join us via Zoom or Facebook, and we invite you to be part of this discussion by sharing your questions in either format. We encourage this to be an interactive discussion, so please don't be shy and ask away. We are joined each week by amazing healthcare professionals from across the nation to provide you with real-world experience, just as if you were sitting across from the table at the clinic. Today, we are joined by Wanda Hofgesang, nurse and certified healing touch practitioner. Thank you again, everyone, for your time and interest, and I'm going to go ahead and turn it over to Wanda.
Hi, good evening, everybody, and thank you, Tony, for a great introduction. And I'm so happy to be here again this evening to be a part of the Mandell's Pharmacist Virtual Learning Experience. As Tony said, she has a lot of years of experience as a nurse, as do I, and a lot of years of fertility. I've been an infertility reproductive medicine nurse for probably 20 years or greater. I do presently work at a fertility clinic in the northern New Jersey area. And I always feel that, teaching and education is a very big part of a fertility and reproductive medicine group. We find that there's a lot of difficult terminology at times that needs to, be made simplified for you, the patient. And one of those areas is medication teaching, which is a big, big part of, obviously, your cycles as you begin your journey. So we're here tonight to be able to, as Tony said, showcase 3 products, which are going to be Menopur, Gonal F, and HCG. And I want you to know that any questions are certainly encouraged when we have the question and answer session. Just know that keep it product specific if you may. We really have to keep things where we're not answering specific questions that pertain to your cycle. We always want to encourage you to reach out to your clinic and your nurse because they are there as the guides as well. We're here to help complement what they do each and every day with their patient education. We want you to become a pro, hopefully, in your medication mixing technique and your administration technique. So a reminder is that all of these videos are included and they are archived on the Mandell's Pharmacy website, and you can watch them at any time. And all of these Facebook Zoom live events are also archived. So just know that you have that to go back as a resource at any time throughout your cycle. It's not just tonight that you have to watch these videos. So the first medication that we will be taking a look at, and we'll watch a video of the mixing and administration of this medication, and then after we will come back live for the Q&A, is Menopur. And just so you'll see, some of you might have a box that looks something like this, or a bigger box that this is in. Menopur is a medication that requires some mixing. So what's nice about this video is if you watch it once and then you get your supplies together, and then are able to mix along with the video and pause where you might need to, I think that's a great recommendation to do that. So just so that you do know. And it's also a good idea that when you receive your medications, that big box, maybe to put like things, like items together Sometimes you'll have multiple boxes of one particular type of product. And so it's good to kind of just organize yourself prior to your cycle in that way. All of these medications may be a part of your cycle, but they're not necessarily all happening at the same time. So it's certainly your clinic's job to be able to let you know what you're starting and when and what dosage. But it's our job tonight to be able to help you feel comfortable with that medication, with the mixing and the administration technique. So without further ado, I think Tony will take it there to that Menopure video, and then we'll come on back for some question and answer. This video is to help you with the mixing and administration of your Menopure injection. Menopure will come to you from the pharmacy in a box, a couple different boxes. They may be a little bigger than this, but this is right now what the box looks like, just in case you're wondering what it looks like and you have it at home. So you want to get that box from your safe place. It does not need to be refrigerated, so you may have this just in a cabinet, which is great. That's fine. If it's in the fridge, it's not wrong either, but it doesn't need to be in the refrigerator, just so that you know. The supplies that you'll need from, oh, nope, I'm going to rewind that before I jump ahead of myself, just to let you know what Menopure is. Menopure contains the hormones of FSH and LH, and both of those hormones work in harmony with our body, again, to help with recruitment and development of multiple follicles, which turn into multiple eggs for possibly insemination or for IVF retrieval. So the Menopure is FSH and a little bit of LH. And we have both of these hormones in our bodies naturally. And when we're administering these into our bodies via an injection, it's putting a little bit more into our system to help us recruit several eggs and mature eggs, which we don't normally have several mature eggs during our natural cycles. So that's really just that's the goal of it, just so you're wondering, why am I taking this? And that's always important to know the why. I think it helps. It helps you to understand. The other part of Menopure is, where do I inject it? Menopure is injected into either the lower belly, lower abdomen, or the upper top, upside outer thighs. That's routinely where we have our patients doing that injection for the fertility clinic I work with. And I think most often that's where most everybody is as well. So the injection goes in the lower belly and or the upper outer thigh, which is a subcutaneous injection. So those injections, you have an option of either self-injecting or someone gives you the injection. And that option, again, is yours. It's not one that it should be your individual choice to figure that out. We want you to feel comfortable with administering this medication. So if you are able to administer your own medicines, great. If they concern you to do that and you want to enlist the help of a significant other, then that's fine too. Do whatever makes your fertility cycle journey the most comfortable for you. So with regards to Menopure, where the supplies that you will need for that is going to be, you will need vials of Menopure that contain a powder or a tablet or a wafer. You know, everybody refers to that a little differently, even amongst nurses, but just so that you know, you will have little vials that'll have a powder or a tablet, and that will be what's in this box that you have of your Menopure. And you will also need to have a Q-cap, which is going to be supplied with you as well. Pardon me for having that upside down, Q-cap. So you need one of those for this medication. You also will need a 3 cc syringe. If it has a needle on it that is long, then you are going to remove the long needle. Just depends what you might get from the pharmacy. They may send you a syringe without any needle in the package, and that's great. That's what you need, because this is a 3 ml, 3 cc syringe. But if it has a needle attached that's very long in length, remove that needle and discard it in your sharps container, because you do not need that long needle for this. Remember, I said this is a subcutaneous injection, which anytime you hear that buzzword or a belly or a thigh shot, that means that it's a tiny injection needle that you will be using to inject with into your body. And then lastly, what you'll need is a 1/2-inch needle. The pharmacy might send you either a 27 gauge or a 30 gauge. Just so you know what those 27G and 30G mean, the higher the number just means the thinner the needle. So the idea here is oftentimes for subcutaneous injections, most commonly it'll be a 1/2-inch needle and a 27 gauge. And usually that has a gray outer little labeling system on it when you get it. Once in a while, the pharmacy might send you a 30 gauge, and that's fine to use too. So there's flexibility with some stuff, and where there is, we want you to know it's okay. But if you're ever confused or you ever have a question, obviously your nurses at your centers are always there to help answer any of those questions that you might have about your Menopur supplies. So once you get your supplies, our next thing is to, again, mixing and administering a medication is not a sterile technique, but it's a clean technique. So it's a good idea to wash those hands. Use a little hand sanitizer if you're not near a sink. I'll just use the hand sanitizer for showing you to make sure that you do know that it's always good to clean those hands. And when you have everything set up, then you're ready to go. So the first thing that we would do with our Menopur is we would have to know our dosage. Your dosage that you might get from the nurses, they may refer to it as you're going to mix 1 powder or 2 powders or 3 powders. We just find sometimes it's easier for patients to understand that, since the 2 types of vials you'll have are powder and or water. So what you want to know is that she will tell you how many powders, but she may also give you a number. With Menopur, each powdered vial is equivalent to 75 units. So if you're a patient that's taking a 75 unit dose, you're mixing 1 powder. If you're a patient that's taking a dosage of 150, you're mixing 2 powders. I think the other thing I've always gotten asked about that, is it 2 shots? Nope, it's not 2 shots. It is simply 1 injection, but the strength of that shot is 2 powders. So that's what's important just to know right off the bat. Don't worry or get concerned or panic that you have 2 shots because you're doing 2 vials. It's 1 injection of Menopur, but your dosage could be a little less or a little more. And what determines that is your doctor at your clinic, based on your history, your diagnosis, and your plan, your age. All of these factors go into effect in coming up with a protocol of which medicines, what dosages, etc. So if my dosage, and I'm going to show both. If I were 75, 1 powder, or 150, 2 powder. So first off, what I do is I take these little plastic tabs that are on top of these vials and I remove them. Okay. Under there, it is sterile. However, like I say, the nurse in me is always wanting to clean the surface of anything that I'm sticking a needle into. So I'm going to clean the surface of these vials for us so that we get ready for our mixing. So we'll clean them, put them down. The next vial you will have is a vial of sterile sodium chloride. You take off that little cap. Once again, get a little alcohol prep pad, clean the top of that. So first thing you're going to notice is I'm only taking 1 vial of water. The ratio, how I always say it to patients, no matter how many vials, how many powders, what number Menopur you're mixing, always 1 vial of water, sterile saline, sterile water, to however many powders you need to mix. And it's always 1 shot. That's the key. So 1 shot, 1 water, but the variable is the number of powders that you need to mix for your dosage. And that dosage could periodically, potentially through your cycle, need to be changed and adjusted based upon your response to your cycle. So just know that this is a variable, but your nurses will guide you every time in telling you what you need to take and how many vials you're mixing. The next step is going to be to grab your syringe, and you're going to open up your Q-cap package, and you will twist your Q-cap onto the syringe. It threads right on there and it twists. Our next step is going to be that we're going to go into this vial of sterile water. Okay? In the vial, we're going to draw up 1 ml. There's a little pressure in that vial when it's new, and it can make it a little difficult sometimes to draw down. The pressure will push on the plunger. So a way to handle that is if whatever you're drawing out of the vial, you inject that amount of air, it'll help equalize that pressure. So draw back to the number 1, lining up the rim of the plunger just on that number 1 line. The Q-cap just gently pushes down on the top of the vial. Turn it upside down, and you'll see when I push, it's going to bubble. And then when I let go, you're going to see that it pushes down on my plunger because of that pressure. But eventually it stops because I did that little tip of adding the air. So what I want to do with this vial is I want to draw up 1 ml. So I would draw down to the number 1, filling it up with 1 ml. One thing to let you know about your Menopur is you will always have extra water when you draw up the 1 ml, because they put 2 mLs per vial of sodium chloride sterile saline. So what you want to know is if there's extra water in here, that's okay, because you're only drawing up to the 1. Once you draw up to the 1 and you have it in the syringe, just wiggle that vial off and discard it. Do not save these sodium chloride vials, not necessary. You have enough in your supply with your prescription. So that can go in regular trash. You will take your first of your powders, attach the Q cap, push down on the liquid. When that water hits that powder, it's like cotton candy hitting your mouth. It melts. So that little powder and that little wafer just dissolves. You can roll it around gently, but don't shake. You just want to reduce the bubbles. So you gently roll it around, keep the needle attached to it. Once it looks like it's all mixed, you're going to drain, drain, drain all the way down to that 1 ml. So I'm going to drain all that fluid that I just mixed in there, which is 1 ml went in, 1 ml comes out. Now this vial is empty. I do not save it. There's nothing I need it for. So I will once again toss in my regular trash. If I were doing a dose of 75 units, 1 powder, now I'm actually done. I do not need to mix anymore. I would take this Q cap off and attach my injection needle. But because I want to show you also how to mix 150, if you're doing 75, you would take the Q cap off after mixing 1 vial and we would put on the injection needle. But if we still need to mix 1 more vial because our dosage is 150, 2 powders, then we're going to cape that same syringe with that same liquid, which has one of the vials of Menopur dissolved already, and push both powders together now with that 1 ml, roll it around, let it mix, draw it back up. And here's where, when you're done with your mixing of your number of powdered vials, all you need to do is twist off the Q cap with the vial, and that can go in regular trash because no blood has come in contact with that. You will then take out your little 27 gauge half-inch needle to inject. If I had any bubbles, I give a little snap to the syringe and that helps the air rise to the top. But if I don't do that step, is there anything wrong? Absolutely not. And I just want to help you right away because this is a mixing medication. Please don't panic about air. Air is more of a concern when you're in a hospital and I'm taking care of you and you have an IV going directly into a vein. Yes, air if you can, and you see a little bubble, you can always flick it. But there will be some little air bubbles you can't remove. And I don't want you to start pushing the medicine and letting it squirt and you're losing valuable drug. So the little bit of air is never going to hurt that little fatty tissue, FYI. Just know that so that you don't worry or panic if you have an air bubble there that won't move. Like I mentioned in the very start of the video, the injection area that we used for this is our lower belly or the upper outer thigh and top thigh. So all in here. And with Menopur, because you will take it more than 1 injection, you'll do approximately 7 to 10 of these injections. It's just good to know that you can move around in that belly every time you give an injection. You move it around a little bit. You could then also incorporate using the thigh and do the thigh as well. So some ladies will do just belly shots. Some ladies will stick with their thighs, or some ladies might combine both. No right or wrong, whatever works for you is fine by us as long as the medication, you have the right dose and the right area that you're injecting. With this medication, like I said, you could self-inject or somebody could give you the injection. So if somebody is giving you this shot, you could lay down. And when they're giving you this injection, the needle goes in at a 90-degree angle in your belly, a 90-degree angle in the top of the thigh, and a 90-degree angle into the side thigh. It's a 90-degree angle. If this were me right now and I'm standing and I'm giving my own injection, if you do give your own shots, which you can, then standing up, the injection 90-degree angle is just like this, the angle straight in. So what we do to get ready for that injection is we clean the area with a little alcohol, just clean that skin. Next step's going to be to pinch and have a little bit of fat. With pinching, be careful that you don't over pinch. I'm just going to show my arm here. When you pinch that fat, lift it a little bit gently. Don't squeeze and grab so tight. If you do, you might bruise, and you just don't want to have a bruise there. If you do get a bruise, some people can bruise from an injection. Don't worry. Just avoid going into the bruise when you give a new shot. It's not uncommon or unusual to bruise when you get your blood drawn or even given a little shot. Not to worry. It's just you want to avoid going into a bruised area to further cause any trauma to that area. So what we do here is we uncap our needle, gently pull it off. We're going to give that little pinch to the skin here. The needle goes in straight in. We do not need to jab. Once we put it to the skin, we're going to give a little push, and it goes all the way. We let go of the fat, and then we push that liquid right in. And then can do a 1, 2, 3 count. Remove the needle. And then what you want to do here, guys, is if your sharps container is nearby, you don't have to recap a dirty needle. You can put it right in the sharps container and then put the cap in there as well. But I'm just going to be safe for me right now and just cap it so I don't have a dirty needle lying around since I don't have my sharps container. But you would put this into the sharps container. With Menopur, you're never reusing any of your supplies to the next shot. Every night you do a shot of Menopur, you gather new supplies and you use all of those supplies up, and then the next night, new supplies. So nothing is ever left over with a Menopur shot. One last little thing I will mention about a Menopur injection is sometimes you may feel a stinging sensation when the liquid goes in, and there's nothing that you did wrong with that. They do use sodium chloride to mix the powder to dissolve it, and sometimes that's just a little irritating to the fatty tissue because we have a lot of nerve endings there. So if you ever feel a little sting, don't panic with a little tiny injection. You've got a lot of, think of a paper cut. Even though it doesn't sometimes go very deep, a paper cut's really sensitive when you get it because of all those nerve endings in that little fatty tissue. So same with the belly. It'll be very fleeting when you feel it, but when that medicine goes in, you definitely can feel a little bit of a sting. And if some of your other medications didn't have that sensation, you might question, did I do this right? And I just want to reassure you that indeed you did mix it correctly. It's just that that's the nature of that medication sometimes when it goes into the body. So I hope this video is helpful for you, and hopefully you will get started with your Menopur and be successful with your mixing, but certainly understand, give it a little bit of time. The first night's the challenge, and then after that you'll become a pro at your mixing of your Menopur. So hey everybody, that was our Menopur injection video. A lot of information, hopefully helpful in there for you if this is a medication that you may be starting this evening, or it's just going to be a part of your cycle and you're preparing for getting ready to start. I don't know, Tony, if we have any further questions that I can answer regarding that Menopur medication.
Yeah, we actually do have a couple questions that came through. Which great video, by the way. It was very good explanation. I liked all the tips in there. So hopefully that is very helpful. So the first question is the biggest side effect associated with Menopur, and is there anything dangerous I should be worried about or prepared for?
With the Menopur, as I mentioned in the beginning of that video, it's part of helping recruit multiple follicles, multiple eggs. So sometimes the biggest thing physically that someone might feel that we recommend, that we talk to you about is you might feel a little pelvic fullness as the follicles grow. It enlarges the ovaries a little bit. But how we help manage that is we do watch you closely while you're on your medication so that we can adjust the dosage if you don't need quite as much. As I said in the video, there are variable dosages, and we look at your response to make those adjustments accordingly. So very rarely, thank goodness, is anybody in pelvic pain. That would never be normal to feel pelvic pain, but we would, certainly guide our patients as such. But you could feel a little fullness and a little bloated sensation in that area and some mild to moderate cramping. In terms of the injection site, as I mentioned at the very end, probably think one of the things most noticeable that patients might share at our clinic is that they do notice it's a little bit of a sting sensation. It's very fleeting, but it might be different from another product that they didn't feel that. So then they question, did they do it right? And I think that's a really big thing to just reassure that if you felt a little sting, that's okay. Some people do get a little bruising at an injection site. Again, nothing dangerous, but just, of course, we guide you with then moving around that bruise and not giving an injection back into a bruised area, giving it time to heal. So I think really the main thing is sort of a localized stinging or burning, a little light bruising. If that happens, is okay. We have you move around that. And mainly just the action of the drug making multiple follicles that you could feel as you're in that cycle, some fullness there in the pelvic region.
Yeah, I would agree with you on that. I feel like in our clinic, that's one of the biggest things when we add the Menopur. We do mention that sting you might have that sensation, because a lot of people don't get that with the gonal. And in our clinic, most patients start with the gonal and add the Menopur in later in the cycle.
Gotcha.
So we always try to make that point so they're not calling the on-call line, which is fine if they do. We'd rather ask questions and be, safe than sorry. But yeah, we definitely add that one as well.
No, absolutely.
Another question that came in, it looks like I will need a lot of Menopur vials to mix up my shot every day. Is there any way to store these so they don't get ruined?
So with Menopur, you can store in the refrigerator. It doesn't have to be, though. It can be either refrigerated or at room temperature. And sometimes what I always encourage our patients is, like food, look at the label, because something that you open up at home that's something food related might say refrigerate after opening. Might not need it to be refrigerated while it was sitting in your shelf, but then after you open it might be refrigerate after opening. A lot of the products have the storage instructions right on the box, as does Menopur. And so one of those things it'll say is that it gives you the temperatures that it can be stored at. So it's either room temperature or refrigeration. I think the other big side note they put on Menopur is protect from light. So basically, if you have it anywhere where there's a light, even if it's outside of the fridge and there's a strong light down on that box, or even in your fridge, you're putting it near the light bulb in a fridge, you might want to put it on a lower shelf, but keep it safe from somebody opening and closing that refrigerator that might be might be apt to get into it, and you really don't want them into your stuff, but you want to have a safe place in your fridge that's not against lighting and all of that.
Perfect. The next question we have, how long before my injection should I mix the vials?
Usually I would say for the clinics, most of us are probably telling our patients, you don't have to mix, you don't want to be mixing too far in advance, because these are activated upon mixing. So usually 15 minutes is fine. You could gather all your supplies, start your mixing, and if you're doing your injections at a particular time that the clinics advise you, or they're allowing you to do it for a range of time, then you can mix it 15 minutes or so before. I think probably the person asking that might be saying, can I mix like today's shot for tonight for tomorrow night, or could I mix like all week of the shots and put those in the fridge? And usually it's not recommended to do that, only because it is activated upon mixing the drug itself. So you don't want to mix so many in advance. You want to mix it that evening, and usually 15-20 minutes beforehand would be ample time. You don't need to do it an hour before or anything like that.
So I don't see any more questions on the Menopur. So if anybody has any, you can always add those in. But before we get ready for the next video, is there anything you want to add on the Menopur, Wanda?
So what I'll say to the Menopur is, and Tony brought up a good point, your clinic is going to guide you with when you need to take that medication. So some clinics do things a little differently. You might start it right at the inception of the cycle, or you might start it a little bit later. There's no real, right or wrong. Everybody sometimes has different ways of doing the protocols. So I want you to know that it's always important to feel comfortable knowing what your clinic wants you to do. And the videos here are the nice complement to giving you the general idea of how to mix and administer that medication. You want me to? I was going to say, we want me to go to that.
Yeah, we'll go ahead. No, we'll go ahead and queue up the next video. So I'm going to go ahead and start the gonal F pen.
Sounds good. The gonal F pen is one of the medications that is a little pen product already mixed for you. So unlike Menopur, does not require mixing, which is a nice little plus. But it does work in the same fashion in the cycles for whether it be insemination or maybe the IVF, which is recruitment of follicles, recruitment of multiple eggs. So it's in the same genre of medications. It's injected in a similar fashion, same areas, but the pen itself looks a little different. There's no mixing here. So Tony will bring that up, and then we'll come on back for some questions. This medication video is to show you how to prepare and inject the Gonal-f ReadyJect pen. First thing to let you know is if you are being prescribed the Gonal-f pen, mainly you're using that to help stimulate follicles or eggs, multiple follicles and eggs, to grow throughout your cycle. So Gonal-f is a stimulation medication, and it contains the hormone of FSH, which is follicle stimulating hormone. So that's the big one that's responsible, whether you're doing an insemination cycle or an IVF cycle. It's helping your body recruit and develop multiple eggs. Once again, I always like to ask or mention first, the supplies that are needed for the Gonal-f pen is one Gonal-f ReadyJect pen and one small needle tip that's provided for you with your pen. Your pen will come in a box, a kit of its own, and the needle tips and the pen will be in there as well. Couple little reminders about this medication is this medication is, again, a subcutaneous injection, like some of the different medications for fertility. So it's administered in either the lower belly or the upper top outer thigh area. That's routinely where, I know for me, our clinic, that's where we have our patients injecting. So you always want to follow your clinic and your nurse's instructions, but routinely that medication is administered in that lower belly and those upper outer side thigh area. So that's a subcutaneous shot. It's a little tiny needle. So again, you have an option where you could self-inject this medication or someone could administer it to you. There's no right or wrong. It's whatever works for you that helps you get through your cycle. So don't feel badly if you hear somebody else saying they give their own shots and you're not comfortable. We want you to always be comfortable with what you're doing in your cycle, and for everybody that's different. So whether you'd like to self-inject or have somebody give you your shot, whatever it takes to help you through the process is most important. With your Gonal-f pen, it may come from the pharmacy and it may suggest to keep it in the refrigerator. Based on the manufacturer's description with this in terms of keeping it refrigerated, if you keep it refrigerated, it's good until the expiration date. If you keep it outside of the refrigerator, it's good for the expiration date or 3 months, whichever comes first. So either or is fine. Oftentimes we just tell patients to put it in the refrigerator because then that gives you the whole time frame and you don't have to worry about calculating. It's just good until that expiration date. Can I take it out of the fridge before injecting? And the answer to that is absolutely. You can put it on the counter for approximately 15 minutes or so. It just brings it up a little bit from that refrigerator temperature and makes it a little bit easier, a little less feeling that you might notice when you inject that liquid. Typically, this medication will not sting, but you'll feel a little pinch with the needle. And sometimes if that fluid's cool, you might feel that too. So certainly you can put it out on the counter and let it warm up a little bit before you inject. So for your supplies, we have the Gonal-f pen. The first thing we do with that is we uncap this pen. And the next step is, it is sterile, guys, under there after the first time you use it, but it's just the nurse in me always has the habit of whenever I'm poking a needle into a surface, I clean that surface. So I'm cleaning the surface because I'm going to poke a needle in here. And the needle that I'm going to poke in comes with this product. It is a little needle tip. You just remove the little seal and then gently attach it. Don't over tighten because you are going to have to take that needle back off when you're done. So you don't want to over tighten too hard. So you just want to tighten it a little bit. And then next step is going to be to follow your clinic's instructions with your dosage. In here, what you will see is there is a little dial and there are some numbers. There, right now it's on 0. What you would do is you would turn to whatever dosage your clinic tells you. So I'm just going to turn this, and by the way, this dial can turn in either direction. So I'm going to turn this dial and I'm just going to simply set it to a dose of 150. So you might be able to see that in there, that it's a dose of 150. Again, that'll be determined by your clinic. The other thing I'll mention with this just quickly is a lot of times patients say, when will I know if it's empty? When you give a dosage after you inject, the dial goes to 0. When that dial goes to 0, that means that you still have medicine in that pen. So put it in the fridge and use it for your next injection. The goal of this pen nicely is that it's already mixed and it's multi-dosed, and you're going to use it up until you're done. Eventually what may happen is when you turn your dial to your dose and you give an injection, if there is ever a number that is not a 0 in that window after giving the shot, that's letting you know, hey, I couldn't give you that injection because I'm now empty. So you would discard this pen, open up and get a new pen with a new needle, and turn the dial to whatever dose this one stopped at after you finished your injection. So if it stopped at a dosage of 50, then you would open a new pen and give just a 50 unit dosage. The other thing I wanted to mention is that the pen is multi-dose. The needles are one-time use. You always only put a needle on, give an injection, and discard that needle into your sharps container that will be given and provided to you by the pharmacy. So the pen itself is multi-use, but not needles. Needles are one-time use, and then you discard, okay? For injection technique for this one, like I said, just to show you that, it will go in either the belly or the upper thigh. So just to get our little mannequin here, in the upper belly, lower belly area, not upper belly because we have some muscle up there, and in our upper thigh, outer thigh area because we have some fatty tissue. So we want to avoid muscle. This is a fatty tissue shot. So if I were giving this mannequin an injection in her belly, I would have her possibly lay down like this, and I would administer the needle to go straight in 90 degree this way, straight in 90 degree this way, or if I'm giving it in the side thigh, it's 90 degree this way. So that would be if she were laying down and I were administering. If she's self-administering and she's standing or sitting, she would be in this position. So what we would want to do to get ready is the first thing is uncap your pen with the big cap and save it, but turn it so that the part that's open is facing up on the counter. And then you'll see that there is a green color here on the tip. We get rid of that one. Don't try to put that back on. I've watched patients do that and they actually stab themselves, and I don't want you to do that. So that one goes in regular trash. Save the other one. And then what you're going to do is you have to clean that area of the belly so that it's good and clean for this injection. And just a little key with your shots, guys, and I'll show this with my arm, is when you're pinching the skin for a fatty shot, you want to give a gentle lift. If you squeeze really hard, you're going to bruise. So sometimes when patients come to me with bruising, I actually have them lift gently so that make sure that they're not squeezing so hard. It's just we're kind of nervous, so we squeeze a little harder, and then that can cause trauma to the skin. So it's this one, it's a gentle little squeeze. Again, we do not have to jab this needle. Just place it to the skin, give a little push. That needle goes all the way in. Once that needle's in, then you are going to push on the end of this pen and push all the way until you feel almost the pressure that you can't push anymore. And once you feel that, count to 1, 2, 3 and let go. Then remove the needle in the same angle that it went in, set it down, and put a little cotton ball to that area. Wipe it if you need to. Usually you do not need to Band-Aid these areas because literally the bleeding stops very quickly. And you'll be able to touch the area after you've given the shot because you won't have felt anything other than the pinch of the needle, which is like a mosquito bite, and usually you will not feel the medication going in. Now what I do is I take a look at that dial, and I do have a 0 in my window there. So that tells me that this pen has more medication. So what I'm going to do is I take the cap and I put that needle into that cap, and I give it a little pinch, and I twist that dirty needle off that I used. I discard it into a sharps container that I will have from the pharmacy, and I reattach the pen cap, and the pen goes back into that refrigerator for your next use. So keep in mind, this medication is subcutaneous, meaning it's a little fatty shot in those thigh or belly. It contains FSH, which is the follicle stimulating hormone, which helps your body recruit and develop those multiple eggs, whether it be that you're doing this for insemination or for IVF. Hope this helped you with your Gonalef, and best of luck with that medication. Hi, everybody. So that was the Gonalef pen. So as you can see, there were some similarities to the Menopur, the mixing, the administration technique using the mannequin and showing the belly, little tiny needle, little tiny like a mosquito bite pinch, but very different because there is no mixing. So that's something that is newer with that product. It's advanced a lot throughout the years. It used to be a mixing product. It used to be little glass ampules. It's come a long way, baby, when we talk about fertility medications. So it's kind of nice that it's in a self-contained pen, easy to use, pretty patient-friendly, just turning the dial and putting needles on, etc. And your clinic is always going to, with that and the Menopur, always give you the days that you're taking that medication, what time of day you're taking it, and the dosage. That's the requirement of your clinics to guide you with that. But the video hopefully was very helpful in preparing and administering for you that medication. Tony, I don't know if we have any further questions there.
Yes. And you did talk about this in the video, but I know we talked about this earlier, and I think this is a good question for everyone to understand. But how exactly does the Gonal-F work to support the fertility cycle?
Well, we do have two hormones in our body naturally in our menstrual cycles, FSH, which is follicle stimulating hormone, and LH, which is luteinizing hormone. And so really what the Gonal-F portion is in your injectable cycle is it contains pure FSH, pure follicle stimulating hormone. So by your body injecting and receiving some more of that hormone than what you have naturally occurring, it allows for multiple eggs to grow and develop. And so really that is somewhat of our goal within reason. We want you to have a nice response with some nice multiple eggs developing, but we always are looking at the dosage and looking to see if there's any need to adjust with more or less. And really the determining factor for that is really your response and how you're doing. And your clinic and your doctor will have determined coming up with a starting dose based on age, diagnosis, and history in order to come up with that protocol of dosage.
And then another question coming in, what if I inject too much Gonal from the pen? What would I do?
With anything with your medications ever, what I always say is never hide behind what you think is, oh my goodness, a really bad mistake or an error or something like that. Always touch base with the clinic. Oftentimes, like my clinic, and I'm sure with Tony too, as she mentioned a little bit in the beginning too, that we do have, even after hours, sometimes emergency line. And so if you're worried ever about a dosage, that is an important thing to maybe give a call and receive some reassurances. We'll take a look at that because you're monitored so frequently. It's oftentimes something that can be corrected if there's a need to do so, or changing a dosage in the future based on something that was done today or yesterday. So just know the biggest policy, I would say the best policy with it, just always be honest, because what we know, we can help work with and correct if we need to. What we don't know, we can't correct.
Perfect. Yeah, I definitely agree. Definitely utilize the on-call line if needed. No nurse is ever upset to answer a phone call about that. We definitely want the best outcome for your IVF cycle. How long will I be on the Gonal?
Oftentimes Gonal-F, and I'll even answer for Menopur that we talked about as well, since they're both similar products for recruiting follicles, is the average is anywhere from 7 to 10 days it may take you to develop the eggs, preparing for either an insemination or maybe an egg retrieval. So just so you know, oftentimes it is for sure, it's individualized, but there's an average, and sometimes that average can be anywhere, maybe in some clinics 5 to 10, but 7 to 10 is about an average, I would say, expectation in terms of injecting those medications.
Now, I think this is a good question. It probably is different for you guys in Jersey than here in New Orleans, but how can I find out if it's better to buy my meds through insurance or just pay out of pocket?
Good question. And what I'll say to that is we do have some people that are have coverage for fertility, but they may have a limited dollar amount. And then that dollar amount can be used towards treatment and the medications. So sometimes, because treatment can be a cost, what we might sometimes also recommend at our clinic is working with a pharmacy like Mandell's is extremely helpful, because they can help guide us with if there are any discounted activity at the moment going on for anyone who might be paying out of pocket for their medications, or there might be some discounted promotions through the manufacturers. And sometimes it might actually benefit you to pay out of pocket, reducing your cost of the medications rather than using your insurance, and it might eat up a big part of your coverage. So really what I would say is that your nurses are probably working with potentially financial people within your practice or your clinic. And then I know as a practice like us, as nurses and the financial department within our clinics, we really work with a lot of the specialty fertility pharmacy, especially like Mandell's. There's a lot of behind the scenes that goes on with communicating and trying to find the best way to handle that. So that's why we will work with you on that and try to give you the best opportunity to maximize your fertility coverage.
Yeah, that's great. That's kind of what we do too. We kind of counsel that sometimes they have the insurance coverage, but unfortunately the specialty pharmacies that the insurance companies work with, sometimes their prices are very high. So it's good to try and help find discounts, and your clinic can help you kind of steer you in that direction of what's out there.
100%, absolutely.
Definitely, we understand it's definitely costly, so we definitely try to get you guys the best price out there. That's all the questions I see on Gonal. I can go ahead and get the HCG ready, unless you have anything else to add. Okay.
I'll talk about that HCG, sure. Before Tony puts up the HCG video, and then we have some questions and answers. HCG is kind of good that we're going over it towards the end of this video presentation tonight, because sometimes you might hear that HCG is called a trigger shot. The acronym of HCG stands for human chorionic gonadotropin. And what you'll see with this is it is a mixing medication. So it's actually similar to what you saw in the previous video with Menopur, similar mixing. What you may see and hear about in this video, but we'll talk about it if we come back and we have any questions, is that there are sometimes different clinics can be using this product either as an intramuscular injection technique or a subcutaneous injection. Subcutaneous is like the shots you saw, Menopur and Gonal-f. Intramuscular you may not have seen yet, of course, tonight. So that would be something that we would show. But we'll come back and go into more of the questions when we have them. But the HCG video, think of trigger, think of preparation for your potential retrieval or even your intrauterine insemination. That's what it's doing, is it's the final maturation step for those eggs, getting them ready for procedure. Hi everyone, the following video is here to show you the mixing and administration instructions for HCG. HCG stands for human chorionic gonadotropin. Sometimes your pharmacy may have sent you a box that has the name on it Pregnil or Novarel, or it might say chorionic gonadotropin. Any one of those three varieties is your HCG injection. And typically this is administered to induce an ovulation. Sometimes it's called the trigger shot by your nurse or by your clinic. When you're taking this, it's to, like I said, initiate an ovulation, and you might be preparing for a procedure to follow, such as an intrauterine insemination or an IVF egg retrieval. Your clinic will review specific mixing instructions for this medication, and they will review your dosage and the method of administration. For the video today, we will demonstrate that this medication can be given either as a subcutaneous injection or it can be given as an intramuscular. If we use intramuscular, we'll demonstrate that we use the buttock muscle for that. And with the subcutaneous, I will show you that it goes in either the lower belly or upper thigh area. Some supplies that you're going to need to get started with this medication, just to give you a little list here, is going to be your box that'll have HCG on there, or Novarel Pregnil. You'll have 1 vial of HCG powder or tablet. So sometimes our lingo is, some nurses will call it a powder or a tablet. Either way, that's the same. You'll have 1 vial of sterile bacteriostatic water. You'll need a 3 milliliter syringe, one of those. And you will need 2 22 gauge 1.5 inch needles if you're doing intramuscular injection. If you're doing subcutaneous, you will be using one 22 gauge, 1.5 inch to mix the product. And then to inject it, you will be using a smaller needle that I'll demonstrate, but is a 27 or 30 gauge 1/2 inch needle, which is a tinier, shorter needle to go just into the fatty tissue. So it's always good to get your supplies together first. Then you can always wash your hands before you're getting ready to do this. Administering an injection is not a sterile technique, but it's always good to have clean hands when you're mixing the product. So what we'll first do is from our box, we will remove the 2 vials that we will have. One of those vials will have the powder in it. We'll simulate that with this one. There'll be a little plastic cap on the top that you remove. And the other vial will have sterile water, which you can see sort of here that we have some water in this one. And you take the cap off, the little plastic cap off that as well. Another good idea to do is that you will use a alcohol prep pad if you have it, or a cotton ball with alcohol, and you'll just wipe the tops here with alcohol. It's just a good idea whenever you're poking a needle into a surface, whether it be skin or vial, to just clean the top of that as well with your alcohol. Your syringe that you'll have, the 3 milliliter syringe, may have the 22 1.5 inch needle already attached, or then that needle might come separately. Either way, we would put that needle onto the syringe to get started. So we'll need the 3 ml 3 cc syringe with this 22 gauge 1.5 inch needle for injecting. And what we will first be doing is I'm going to demonstrate a basic mixing method with this, but your clinic will review how much liquid to mix with, and they'll give you specifics. But even seeing my way of mixing is going to give you what you need to know in terms of the mixing. So for the demonstration, what we'll do is we'll mix with 1 ml 1 cc. So what we do is we draw down the plunger and we draw up a little air, and then we uncap the needle, and we first take our vial of sterile water, and we're going to inject a little air into that because there's a little pressure in that vial. So it's nice to kind of equalize that little bit of that pressure in there with entering a little bit of air into it first. If you forget this step, I don't want you to worry, but I just want you to know it's something that we can do, because as I let go of that plunger, it sort of has a little mind of its own and it's moving. But then what happens is eventually that'll all stop, and I will be able to have full control over what I'm drawing up. So in this case, we're going to draw down that plunger rim to the number 1 ml 1 cc. Once we remove that needle, this is extra fluid that you do not need to keep around, and you can put it safely into regular trash because there's been no blood contact with it, so you don't have to put it in your sharps container. Then we're going to take the sterile fluid that we've drawn up, and insert it into the powder tablet, wafer, however you want to refer to that powdered vial, and inject all that fluid in there. At first it'll be cloudy, but then just keep that needle in there, and what you're going to do with that needle while it's in there is just roll around gently. It takes a few minutes to do this step, but just let it take, don't rush it. You just don't want to shake vigorously and create a lot of bubbles with it. If you can, you want to kind of minimize all that bubbling effect. Once you see that it looks pretty clear in there, the next step is to turn the vial, or some people say invert the vial upside down. The next little cue that I always give to everybody is make sure to move that needle down as low as you can without having it fall out, because then what you're going to do is pull back on the plunger and drain every little drop that you've pushed into that vial. So 1 ml went in, 1 ml is what should come out. If you're slightly under it, is that okay? Absolutely. But if you're at a half, go back in, because that means you'll have the other half still left in the vial. So what went into that vial, the 1 ml, as close to that is what you want to remove from that vial, that 1 ml. Then this vial here will, once again, this is also going to now be empty because we've drained everything. So this can go into regular trash. You don't have to put it into a biohazard container. And then you cap the needle that you've been working with for mixing. Here's where there'll be 2 differences, and I'll show the intramuscular shot first. After we have our ready mixed vial here, syringe, we're going to remove this 22 gauge 1.5 inch needle and discard, and we could open a new package with a 22 gauge 1.5 inch needle that we'll borrow from that new package. In this case, we would simply not use the syringe that came with it, but take the brand fresh new needle that's nice and sterile, because that's going to mean that's going to be good for your injection. this would be the needle that is used for a buttock muscle injection. If I were doing a subcutaneous injection on the advice of my clinic, which they will let you know, and that would be something going into the belly or the upper thigh, then you would be using a much smaller needle. So the only step that would be different is, I'm just going to take this off for a second and set it down. The only step that would be different is after mixing, I would then attach the very small needle to get ready for preparation of the injection. So we'll put that one back into that packet, and I'll come back to that. But I just wanted you to see that the mixing needle is a longer needle, so it goes in those vials, and then you may be switching to a new needle that's longer for a muscle shot, or a smaller needle that might be for that subcutaneous injection. And I'll just move everything away here. And what we're going to do is, this is an injection if we're showing and demonstrating the muscle shot first. Typically, your nurses in clinic may have drawn some circles on the upper outer quadrant of the buttocks, just to show this side here. It's just to show you that the needle's going into that red area. So we're kind of not doing a subcutaneous, which is the fatty tissue, but we're doing into that muscle, that's that glute muscle, and that's a nice big muscle for that. So a lot of times some people have asked if they can do this in the leg. It's usually preferred to give it here because this is a non-weight bearing muscle. So we sort of would avoid sometimes doing the quadricep or the deltoid of the arm because that's a small muscle. So often you'll see that your clinic centers may be circling this area for you to administer this trigger shot. If somebody, it's recommended with this one, if somebody can, to be administering this to you. And if you were to choose to stand for the injection, what I would do is, if I was getting the injection in my right glute, I would stand with all my weight on the left side, and I could lean a little bit just so that I'm not wobbling. I could put down my right foot, and that person would have a nice relaxed muscle to administer that injection into my right glute. However, if you would like, you could lay down simply, and if I have this mannequin and she were laying down here and I was administering the injection, then by having her lay on her side and I'm administering the shot right here, the muscle's already relaxed. So either way is fine. There is no right or wrong way of standing or lying down. It's just whatever works for you, and that's what we would always want you to do, is whatever works for you. Some people ask if they can put a little ice to the area. For this injection, a lot of the clinics might say it's okay to put a little ice to numb the surface because you are going a little deeper and that will not interfere with absorption. Or your clinic may be working with you and may have ordered you some Sonera patches, which is a type of numbing patch that you would apply about 20 to 30 minutes before this injection and then remove it to then administer the injection. So if you don't have the patch, it's certainly okay to sometimes, with your clinics, okay, use a little ice just to numb it. If you didn't ice, what I will say is that a lot of times by now you've had several blood draws from your arm. The pinch that you could feel a little bit here is just like a blood draw, even a lot less, because it's not going into a vein, it's just going into your muscle. So I want to give you confidence to know that not to worry about the needle going in, because you've experienced that already with those blood draws. With this, after you do the icing, or if you use a patch, what you're going to do is clean the area with a little alcohol, and then you're not going to pinch the skin. We need to leave it just as is because we want to get that needle right into the muscle. So the angle that you might see me holding this might look like a slight 45-degree angle to you, and your other hand could be here, wherever you position it that's comfortable for the person giving it. But a slight little angle, so I'm not pointing the needle down toward the floor, and I'm not parallel to the floor. It's a nice little angle so that it's going into the muscle. We don't need to jab with this. If you do see that you have a little bubble in here, or a little air bubble, is that something you want to address? You can give a little flick to the syringe. It usually rises that bubble up to the top. But if it's a real tiny one, I don't want you to worry either, because you're not using this into a vein, and that's when we really want to look for air bubbles. For a muscle shot, it's okay if you had a very small bubble there that just can't be moved, and I can even have that happen to me as well. So it's okay to flick at that to release it, but if it doesn't release, it's certainly okay to proceed with your injection. When you're doing this, like I said, it's a nice gentle angle in and a nice insertion. We do not need to jab. So you place the needle to the skin and then give a little gentle push. If you've iced or used Sonera, you might not feel anything at that point. If you didn't ice or Sonera, you might feel just a slight pinch to that skin, sort of like a blood draw when that needle goes in. The next step is to hold this needle in place and pull back lightly, gently, not a lot, not very far, on the plunger. Why we're doing that is we're just checking to see if any blood enters the syringe. If you've had these areas drawn, it's very unlikely that you will enter a little vessel or a little vein. That's the reason for this check. So I want to reassure you that it's not very common to happen, but when you pull back, if you were to see blood enter here, clinics might do different things, so you follow their instruction, but what we would do is either remove the needle completely if we see a little blood enter, put a little Band-Aid here, change the needle and go to the other side to reattempt. Or the other way you could handle it is if you see a little blood, you could pull the needle away from the skin, approximately a ½ an inch, check again, and if no further bleeding enters, then you could just inject. Either way is how you'll be instructed with your nurse's help in your clinic, but that's just addressing that if you do see blood, you don't want to insert the medication. You want to hold off and reposition or remove it and go to the other side and reattempt. Either way, eventually you will get to the point where you're not going to see any blood, and you probably won't even see it the first time, and then you'll just inject nicely that fluid, let it all go in. Can do a little count of 1, 2, 3. Remove the angle, remove the needle at the same angle as going in, set it down, and then you just put a little cotton ball there. A little bit of blood will come out, a little bit of the fluid, not a lot. It'll only take 10 seconds of holding this here, not even. And then you might have it where it will stop and it'll have a little pinprick there. And you can apply a Band-Aid if you need to. Just remember you have that there. Don't forget, because it's in the back of your body. Just because Band-Aids, even if you don't have an allergy, sometimes can get a little, you might get a little irritated from that. So you just want to be able to know you don't have to leave a Band-Aid on for 24 hours or anything like that. Just for the quick 10 or 15 minutes, and then you can remove it. If this injection is being instructed by your clinic to take it as a subcutaneous injection, then what you want to know with that is the areas typically that they will reference for you is going to be in the lower abdomen and the top upper or side outer thigh area, because it wants to be in any area that where you can pinch a little fat. So using my arm for that, I'm pinching a little bit of fatty tissue off of the muscle. And when you do that pinching, just do a little gentle lift. You don't have to squeeze too hard so that you're not traumatizing your skin by squeezing so hard. You could, with that little shot, subcutaneous injection, you could administer that to yourself, or you could have someone administer that to you. So that's an option. The intramuscular, it's usually recommended if you have someone that can give you that shot, it would be preferred. But with this injection, if you felt comfortable, you could self-administer, or you could have somebody give you the injection. If somebody were to have someone else give them this injection, I usually sometimes recommend that the patient could lay down and you would administer it into her belly this way, because it's a 90-degree angle, or you could administer it into the top thigh this way. Or if we're doing the side thigh, then the 90-degree angle to the side thigh is administering it like this. So it's a 90-degree angle, and if you're getting the shot given to you, then you could lay down. If you are administering the shot to yourself, then you would be in a position of where you could stand or sit, and you would be giving this straight into your belly, straight into the top thigh, and bring it into the side thigh to the side area, like we showed earlier, a little bit of that side thigh. So again, the angle for this one is a straight in, but it's a smaller needle just going ½ an inch into the fatty tissue. So if we demonstrate that one, if somebody were self-injecting, question might get asked, can I put a little ice here? You could, but it's sometimes is recommended if you're going to do anything here, maybe to use one of the numbing patches if you have that option, that's ordered for you. But even if you don't have the numbing patch ordered, recommendation is you don't really have to ice these. It's such a tiny needle, you may not even barely feel it. At most, it might feel like a mosquito bite. We all know how that feels. It's a very quick, fleeting pinch. The reason sometimes we recommend refraining from icing with the smaller shots is that you don't want to constrict blood flow. Blood flow needs to be open in the little capillaries to help that medicine be delivered to where it needs to go. So the idea here is just we don't want to interfere with that. The numbing patch won't interfere with that, but the ice, if you leave it on too long, could. So it's best to just know that you really don't need the the ice for this. And oftentimes patients, when I do demonstrate this, they will let me know afterwards that it really wasn't as bad, and I was right, that it felt like a pinch or nothing at all. So I want to reassure you all of the same thing, that it really is something that you won't notice very much when the needle goes in, because it's so fine, that needle. This time we do need to give a little pinch to the fatty tissue. So what you want to know with that is you're giving a gentle little squeeze to the skin, like I said, not a harsh squeeze. You uncap your needle, And then when you have that little pinch of fat, you place the needle right to the skin and just give a gentle little push. Once it's all the way in, you can then push the medication in, nice and gentle. Count 1, 2, 3. Remove the needle, same angle as going in, let it out, and then put a little pressure there. Here, if you'd like to Band-Aid, you usually don't though. If anything, you might see a little clear fluid come out of this opening. So that's the medicine, so we want to make sure we put a little pressure and keep it there, keep it inside the body, but usually not needing to have to do anything with any sort of Band-Aids or anything like that. And then with all of your medications, after you are done with them, when you have this dirty needle and syringe, it goes into that Sharps container. So there is no leftover with trigger HCG. Everything you typically mix is going to then be utilized for that evening, that day, or that evening, or that morning, whatever time you're taking this. Your clinic will give you specifics with when you're taking it, how much water you're mixing with. Today's demo was to just show you the demo of mixing, and we use 1 ml, 1 cc, but you might use more, you might use less, or you will absolutely be instructed whether you're taking it as a belly shot or thigh shot, little tiny injection, or whether it will be in the muscle. So I do hope this video has helped you. If you've gotten to this point, I know you have good things ahead, and we congratulate you on getting to this point of a trigger shot, and best of luck to you with the rest of your cycle. And we'll see you back here for some future videos. So hopefully that was helpful. I think the trigger shot tends to be a very big shot in most of our clinics, and patients have heard a lot about it. So they certainly get concerns or worries, lots of questions around this. So there's a lot of patient education going on in most clinics like Tony's and mine, where we're always doing all that we can to make sure that patients are properly instructed for them on their dosage, their method of administration with this medication. So this one gets a lot of attention, and I'm sure Tony would agree with me. And I don't know if there's further questions that anyone has out there about it.
Oh yes, this is the big one for sure. I actually liked in the video that you commented after the IM injection, which typically we do ours IM in our clinic for IVF. A lot of our intrauterine inseminations are sub-Q. So we do teach it both ways depending on the cycle type. But the fluid coming out at the end, sometimes with the IM, tends to make people nervous that they did something wrong. So it is okay, just to wipe that little bit off, and you still did get majority of the dose. So we try to, set their mind at ease for that.
Exactly.
Just a few questions so far. How do I know exactly what time to take my trigger shot?
This is something that, as I said, there's a lot of teaching that goes on with this. I know at most clinics like our own, when you are doing this for a cycle that might be for intrauterine insemination, oftentimes you may be given a range of time that you can take it. Just for example, you might be told anywhere between 7 in the evening to 9 in the evening. So you may be given a range depending upon the procedure. With IVF, usually you're given a very specific time, because oftentimes most clinics are doing one retrieval at one time, meaning each person has their own scheduled time for retrieval, and how you have that scheduled time is based on your trigger shot time. So just know that, that is an important key factor with IVF cycles, is that this is the one medication, and pretty much the only medication I would say that's in our clinic at least, and most often everybody else as well, that is a timed injection. And that means that the time that's given is very important to follow that, because of the setting up of the operating room and the schedule with what you're doing when you're under anesthesia for retrieval. At least that's where we're at with our clinic in terms of doing that.
Yes, absolutely. This is another good question. Can I mix my trigger shot ahead of time, and do I have to be at home to administer it?
I have had some people probably be at restaurants out doing the same thing, right? You should know hopefully by the day's end at a clinic what time you're taking your injection. So usually most of us might have a 9 to 5 day or an 8:30 to 4:30 day. So you might be hearing from the clinic for sure by the end of that time frame during the day. So you'll be able to prepare for that evening. And if you do have plans being somewhere, I guess if you're somewhere that you can at least get the injection, then sometimes we do tell patients, if you're traveling to a different location and you're going to be available to do the shot at that location, main thing is bring the medication with you. What was the other question? I think it was time. What, I forget now. We said if we're a different location, or I can't remember the first part of that.
Oh, do I have to be at home, and can I mix it ahead of time?
Yeah. In terms of like mixing ahead of time, again, being that it's powder water, it's activated upon mixing. So usually most clinics will recommend mixing it no sooner than 20 minutes or so, give or take 15 minutes, and then be prepared to do that. I know for us, even, there are times when patients have a very late injection. It might even be when they're normally in bed. And you know what we always tell patients, take your phone, set a timer. If your time of your shot is midnight, then make sure to set your timer at about 11:30 so you can gather your supplies and start your mixing at about 11:45. Because I know for me, I'm up at 4:30 a.m. So that would be a very late evening to be up that late. So, you know, we often will remind you, because it's not unusual that somebody could be tired and they may fall asleep early, and we want them to know to be able to do little tricks of the trade, if you will, and making sure you get that shot at the time you're told to take it.
Yes, absolutely. The timers become your best friend when you're doing your IVF meds. You definitely don't want to miss the trigger shot time.
Exactly.
And then if you do, all you can do is just let your clinic know, and they'll direct you from there as to if it's something that can be moved, or, you know, they'll go through the next steps from there.
Exactly.
Another question we have, which is a good one, we get this kind of stuff a lot too. I was prescribed Pregnel, but my friend was prescribed Avidril. Is there a difference between them?
Most often, with regards to the trigger or the HCGs or the Avidrils, first off, to be quite frank, one of the things we want to always work with is which products might be considered in your insurance formulary, meaning that there are certain products that you might have coverage for and other products that may not be covered for you, and you'd pay more out of pocket. We're never going to compromise your cycle in that choice. But to be honest with you, when it comes to the HCGs and the triggers and the different names, there are times that you could use interchangeably one or the other. Avidril is a little different than the HCGs that you saw that I mixed, because Avidril, it's a subcutaneous, but it's a pre-filled syringe ready to inject. So sometimes there just might be dosage variations, but if you're covered for one, like the Avidril, there's a way for us to make sure that you get the full dosage. And there are some clinics that might be having their patients use one or two of those pre-filled injections to give them the full benefit of the drug, even though it's a different named product and the way it looks. And then the HCGs might have a one bottle, one box that is a higher dose that equals 2 of the Avidril. So there's a lot of little different variations out there, guys. I wouldn't get so hung up on that. I would want you to know that every clinic is going to always do what they can to try to make sure that you're getting what is hopefully the best product for you in terms of response with dosage, not so much the drug's name and presentation, and really their coverage. Working with those insurance coverage is very much key to all of us.
Yes, absolutely. So I don't see any more questions before we wrap up. I know you wanted to add something kind of at the end, so if you want to take over there, and if something else comes through, we can address that.
Sure. Okie dokie. So I was telling Tony, I'm a certified healing touch practitioner. It works with energy medicine. And what I find with fertility is patients often ask about the stress. Is stress going to cause me to be having difficulty getting pregnant? It's not just stress. We all have stressors in our lives. We're always going to have stress of some sort, of some level. I think it's how we respond to it that is the most critical key factor in that. So I don't say necessarily that stress can't be a factor, but it's your response to it. So in giving you some little tips, our hands have energy centers here, and I've showed this before on some previous live events. And I have a little trick of something that can help be calming to stress levels and stopping unwanted negative thoughts. It's called the forward back head hold. So you would take one hand and place it on your forehead, and then on the back of the head where you have that little bumpy ridge there, that's the occipital ridge, you would kind of gently hold. You don't want to put hard, heavy-handed pressure, but a gentle little hold. If you can be quiet in a room by yourself, sitting up, laying down, however you want to position yourself for this, calming music is nice. Being able to just take some nice breaths. This can be a really great technique because when we are in fight, flight, or freeze, the blood flow leaves our forebrain and it goes to our extremities. So that when we're in flight, we need our extremities to have the energy to run, or we might freeze and stay still, or we might fight. So the idea here is that because you have nice energy in those hands, of the center of those hands, and we all have it, by placing our hands one behind and one ahead, so we have that forward back head hug, I like to call it. It's a nice little hug. What it does is it puts blood flow back into those areas. If we don't move that energy from the trigger out of our body, what can happen is it can stay stuck, and it can cause our, disharmony within our body. It can make us feel anxious. So this is a nice calming hold to bring blood and oxygen back to the brain, helping us to find peace and clarity. The other nice thing to add to this is I'm a believer of affirmations, and I've shared this in the past too. A nice affirmation for our fertility patients is, I love and approve of myself. Because how many times do we do a lot of not so nice talk about ourselves? Like, why do I have to do this? My body's not helping me. I don't want to have to do this. Your body's listening to that. Thoughts are very powerful. Affirmations are statements that describe a goal in its already completed state. So by you saying, I love and approve of myself, even if there's a little part of self-doubt in that, by just saying that, your body hears that, and it reinforces as you bring more energy into any thought or action, it'll increase the powers of creation of that affirmation. So a little forehead, back head hold, a nice calming couple breaths, and I love and approve of myself. And even just saying that a couple times before you start the cycle, during your cycle, anytime you need to do this, even for our nurses out there, we all can use that tip. So I hope you find that helpful. Use it whenever you like to. And a reminder, Tony's going to wrap up here, but I thank everybody for being with us tonight. It's always great to be a part of the virtual learning experiences through Mandell's Pharmacy. They do a great job at getting all of us as professionals to kind of use what we like to do, which is a lot of patient care, a lot of patient education. And so it's a great forum for that. And Tony will let you know how these videos will be stored for you for future use. But thanks again for everybody for tuning in to us tonight. Thanks, Tony, for having me.
Yes, thank you, Wanda, for your time and expertise tonight. The purpose of our program always is to ask questions here in a comfortable space. Thank you for everyone who joined on Facebook and Zoom, and for sharing those excellent questions. We hope you're able to learn something tonight. And even if you didn't ask a question, we hope that, something triggered something that you wanted to ask, but were maybe too shy or just didn't get a chance to. All of these learning experience videos, as well as the product demonstrations, are available on our YouTube page, the Facebook page, and the mymandells.com pharmacist page. So we truly believe that repetition leads to retention. So watch these a few times, you'll get more comfortable, and that stress and anxiety will kind of start to subside the more you do it. By the time your end of your cycle is over in 2 weeks, you're like, wow, that wasn't so bad.
Exactly.
We look forward to seeing everyone here Monday night at 7 p.m. Eastern for another great program. And if you know anyone that could benefit from this program, please share that, a friend, a colleague, anyone going through fertility treatment. This is a good way for them to learn in a comfortable space. So thank you, everyone, for joining. We'll see you next Monday. Have a good night.
Bye, everyone. Bye, Tony. Have a good one.
You too.